coming to you from Kearney County Health Services. For those that don't know me, I'm Shannon Kuehn. I'm one of the nurse practitioners here.
I'm Wulf. I'm also one of the nurse practitioners. Both of us are working in the respiratory clinic now.
And we're coming to you today because we have concerns about our increasing rates of COVID-19 here in Kearney County and then of course in our surrounding areas. And so we are reaching out to our community, to all of you, to try to help us because we need help, and it's going to take an entire group of us to get there. Our main reasons why we want to reach out is because we have certain goals in mind. Number one, we would like to keep all of our children in school. That is a high priority for all of us here at Kearney County Health Services, as I'm sure most of you. Number two, we would like all of our businesses to be able to stay open. We know everybody needs to pay their bills, and so we need all of our businesses to stay open, and we can only do that if we help decrease our spread of COVID-19. And of course, probably should be number one, we don't want anyone to get any sicker. We don't want to lose anyone in Kearney County if we can help it. We want to prevent the loss of life due to COVID-19, which, as we all know, can happen easily, unfortunately.
So like Shannon was saying, obviously we want people to stay healthy, but we know that because of this disease, we're going to see people who are sick. And because of that, there are a number of things that each person that occupies this county can do to help us prevent or decrease the spread of this disease. And so we're going to talk about a few of those things. One of the most important is understanding that if you are ill, and very important, stay home, isolate, stay away from other people. And we ask that primarily just so that we can get our hands around the spread of this disease right now. We're seeing a tremendous increase in this county, and your help will help us. So stay home if you have symptoms such as cough, shortness of breath, runny nose, sore throat, fever, loss of taste and smell. Some of those are the ones the symptoms that we're seeing that are the most typical in this disease. We also want you to make sure that you're staying home if you've been tested and you're waiting for results. Even if you don't have symptoms and you've been tested for a reason, obviously. So you should go home and you should quarantine at home, and you should quarantine with your family. Because if you're having symptoms and you're requiring testing, the likelihood is that you have the potential of spreading it to your family, because we're together with our families every day. And then also, of course, if you test positive for COVID, or a member of your household tests positive and you're being quarantined, you must stay home. Very important for us at this point to get our hands wrapped around this, and in order to do that, we need people to follow the rules as they've been established for this disease.
We know that everybody is getting tired. We are all COVID tired. You're tired, we're tired, everybody is tired of COVID. And we're going to review some of the things that you can do to help prevent the transmission of COVID, which we know you have heard over and over and over. But we obviously need to do a better job because our numbers are increasing rapidly. Number one is our masks. Masks need to be worn properly. As you can see, our nose being covered and our mouth being covered, or it does no good. The other thing is you need to make sure you're washing your masks. A disposable mask like the ones we're wearing should be used one day and then thrown away. They should not be reused over and over. A cloth mask can be reused, but it needs to be washed. It needs to be washed every day after you use it. Rotate it through with other ones, whatever you need to do, but we have to wear masks. When we say wear masks and social distance, that means, of course, 6 feet apart from people that are not in your own household. Our kids are doing it at school. They're wearing masks and social distancing, and they've done an excellent job. Adults need to do the same. We ask that if you're riding in a vehicle with people who do not live in your home, that people in that car wear a mask. We see it happen from a short trip to Kearney, or from people at a Bible study, or a small social gathering. If you're with people that are not in your house, we ask you to please have a mask on. That's where the spread starts, and then people don't realize they have it and they go to work and they share it, or they go to church and they share it, or something like that. So we're asking you to wear your masks anytime you're not around your family members only, or the people you should be without a mask. Hand hygiene is, of course, very important. That's been important from the beginning of time, but even more so now. So using hand sanitizer frequently, washing your hands for at least 20 seconds, and doing that every time you go into the store, come back to your car, maybe put some hand sanitizer on. Those small steps make a huge difference. The other thing that we would like to encourage is, if you own a business here in town, requiring masks at your business will help all of us. Because if I can't go into a business without a mask on, well then I have to wear it, and I won't transmit the virus possibly, or catch it from someone else. So if you own a business here in town, we would love nothing more than for you to require masks at your business. And finally, and one of the hardest things for myself and all of us, is that we have holidays coming up. And there's nothing more than what we want to do is to spend holidays with our extended family and friends that we can get together with. But we ask that you don't do that this year. It's hard, I realize that, but stay with your immediate family, those that you are with all the time, and celebrate in a different manner this year. If we go out and we have large group gatherings of 40 people, 20 people, whatever, and we don't know we have COVID-19, we will spread it to all of those, and then they will spread it to others, and we will continue on this path. And then those goals we talked about will be gone. We will have to close businesses and schools, because that's where we will be headed.
So unless you have made the decision to just completely disconnect from society, you've probably heard that we're seeing a significant number of COVID patients in our region, to a point where we have made the decision that there is an element of urgency here, and we need to start making some changes at our facility. Today, a group of administrators and the medical staff here at Kearney County Health Services met to make some decisions about what we need to do. And I think that it's important for us to share those with you guys now, so that you're aware. If you remember, when the entire pandemic began, we made some pretty drastic decisions here, and we're going to return to some of those. The decision has been, at least temporarily, we've made the decision that we will monitor the situation here week by week, with hopes that we'll be able to lift some of these restrictions quickly. One of the first things that we're going to do is we're going to go back to restricting visitors from our facility. That means visitors that would otherwise be coming in to see our patients, visitors that might be coming into our clinic. We're going to be restricting outside agencies from coming in, such as drug representatives and those types of people, just in hopes that we can help decrease the spread, because we anticipate that there are going to be a large number of patients in our facility who are going to be COVID positive. So that's the first thing that we're doing. The second thing that we're going to do, in hopes that we can keep well people at home and away from sick people here in our facility, is we've made the decision to temporarily discontinue wellness visits or regular checkups. Those are things that we feel we can put off for a few weeks or a couple of months if necessary, and it just keeps those people who are otherwise feeling well from coming in and potentially being exposed to what we anticipate to be a large number of sick patients. And then finally, I think that it is important for us to also share, we've not made a formal decision on this, but we may get to a point here soon where we make the decision that we're not able to move on with elective procedures such as surgeries or colonoscopies in our facility. Now again, I reiterate, we've not made that decision formal, but I think it's important that people understand the critical nature of where we're at right now, and kind of the firm stance that we're planning to make here at our facility. So to kind of wrap this up, the biggest thing that we want people that are choosing to watch this video to understand is there is urgency in this, and we understand and appreciate that some people may not quite have a grasp on that. And if it hasn't impacted your family yet, I'm afraid that it probably will. But we're here to tell you that it has a hold of our community here in our county, and we're seeing a definite spike in the numbers. And because of that, we're asking for the entire community's help in making this better, because as Shannon said, we're tired of this. And when we say that, we're truly physically tired. The staff of this facility are wearing down because of what this disease has done and the work that it's creating for us. Your help will help us in turn help you when the time comes that you need us. And we'll be ready for everybody. But if we can spread that out and we can make the work a little bit easier by seeing fewer patients because we are decreasing the spread, that'll help us in turn. So we appreciate your time. We hope that this might help answer some questions that you may have. Certainly we hope that it will help you know that we're trying to be very transparent with what we're doing here at our facility. We encourage you, if you have questions or concerns, to please call us. We do ask that if you are feeling ill and you do need to see us, that you contact us first, you call us so that we can plan for you accordingly. We are not taking walk-in patients for illness right now. We plan to keep our clinic open for urgent care patients, patients that even, you know, everybody, we're still going to have accidents, we're still going to have urgent needs, and we'll plan to see you in our clinic for that. But right now we're preparing ourselves for what we anticipate to be kind of a dark season. So we appreciate your help, we appreciate your time. If you have any questions, please give us a call.